Hello, this is Heather Ali and welcome to Heather's lectures. Today we will cover the second lecture of pharmacology and we will study the famous drugs regarding DHA examination for pharmacists, and this lecture is also for MOH exam, HAAD exam, SPLE exam and DHA exam, the Dubai Health Authority exam for pharmacists. So let's start. The first drug is phentolamine. Phentolamine is very important drug, and a lot of questions have asked in previous or past papers. So phentolamine is alpha blocker. It is a reversible, non-selective alpha blocker, and it is used to treat hypertension, and phentolamine also used to treat norepinephrine reactions. The reactions which occur due to norepinephrine, so we use phentolamine there. So one of the important point here is that it is used for hypertension and it is alpha blocker. So it means if we will stimulate alpha 1 receptors, it will cause high blood pressure, or it will elevate blood pressure. Okay, the second drug is epinephrine or adrenaline. Epinephrine is also known as adrenaline. It is catecholamine and it is used for anaphylaxis reaction, for allergic reactions, serious allergic reactions. Amphetamine. Amphetamine is CNS stimulant drug. After taking amphetamine, you will be too confident, overconfident, and the second most important point of amphetamine is it stimulates the release of norepinephrine. So amphetamine and catecholamines are interlinked. The fourth drug is rivastigmine. Alzheimer's disease drug, rivastigmine. It is cholinesterase inhibitor. The cholinesterase is an enzyme. So it is used in dementia caused by Alzheimer's disease and Parkinson's disease. Catecholamines, I have told you that the catecholamines are epinephrine, norepinephrine, dopamine, serotonin. All these catecholamines are metabolized by COMT. What is COMT? It is catecholamine methyl transferase enzyme. So this is very important. They can give you structure of epinephrine, norepinephrine, dopamine. So you have to identify the structure of epinephrine, norepinephrine, adrenaline, noradrenaline, and they will ask you that which enzyme will metabolize these. Picrotoxin. Picrotoxin is a toxin obtained from a shrub. So it is used basically after surgical procedures or after operations when someone get respiratory depression, serious respiratory depression. For example, what is the concept behind it? It is basically GABA antagonist. So when someone will take anesthesia for surgical procedure, the person will go to CNS depression because anesthetic drugs will cause CNS depression. So it is a GABA antagonist. It means the GABA is inhibitory, so it will antagonize the GABA, or simply the picrotoxin will stimulate CNS. So a person will be recovered from anesthetic induced respiratory depression. Diazepam is a benzodiazepine drug. So there is one concept here. This is the classification of benzodiazepine drugs: long acting, intermediate acting, short acting. Long, intermediate, short is basically time. Like long acting drugs will be in the body for 3 days. Their action is for 3 days. Intermediate, their action may be for 16 hours, and short, their action may be for 3 hours, 5 hours. So the diazepam will decrease MAC for anesthetic drugs. What is the meaning of this MAC? Minimum alveolar concentration. Like you are giving a drug, anesthetic drug, any drug like propofol to a person. Like you are giving 100 mg to a person. Like 100 mg will be for that person to induce anesthesia. Below 100 mg, it will be difficult to induce anesthesia in that person. So when you will add diazepam with propofol, what diazepam will do, it will decrease the MAC. What will happen after decreasing the MAC? Even you will give 50 mg of propofol, it will be enough to induce anesthesia. Like it will make the anesthetic drug more potent, more powerful. Low mg will be required to induce anesthesia. Now the two drugs, tubocurarine and succinylcholine, they are muscle relaxants and they cause muscle paralysis. They are basically used in operation or surgical procedures, and the difference in between these two is one is non-depolarizing and the other one cause depolarization. One is for short term. Succinylcholine works for short term and tubocurarine is for long procedures, long surgical procedures. Succinylcholine basically is used for intubation procedure. So tubocurarine is more potent than succinylcholine. Here this classification is very important. I told you that the three most important classifications are antiarrhythmic drug classification. Antiplatelet drugs are the drugs that is used for clot lysing or to prevent clotting, to inhibit clotting factors. Like these drugs, this is also a classification. This is very important classification. You will get 2 to 3 to 5 MCQs from antiarrhythmic drugs and these drugs. The other classification is of calcium channel blockers. That one is also very important classification. So first of all, you have to see the antiplatelet drugs. Antiplatelet is basically one of the class of the classification of the drugs used for clot lysing. So this is the antiplatelet class. This is the anticoagulant class. This is thrombolytics, or which lyse fibrin clots, and these drugs for bleeding. So antiplatelet drugs are which inhibit platelet formation. The most important is aspirin, clopidogrel, prasugrel, ticagrelor, and ticlopidine. These drugs are used for the prophylaxis of stroke. It means these drugs are used to prevent or to cure stroke. Anticoagulants, all the drugs with ending with saban, apixaban, fondaparinux. This drug is very important as lot of questions in previous exams or past papers have been asked about the structure of fondaparinux. They'll give you the structure and they'll ask you to identify the drug. Heparin and enoxaparin. Heparin and enoxaparin, these are very important drugs, and they will ask you the dose of enoxaparin, they'll ask you the route of enoxaparin, a lot of other things. Warfarin, important drug. Dabigatran. Now this is alteplase enzyme like streptokinase. These drugs are used to lyse fibrin clots. The streptokinase injections is used for serious heart attack. For bleeding, vitamin K injection. Vitamin K also available in injection form and in oral and tablet forms. Like lot of multivitamins contain vitamin K. Aminocaproic acid used to prevent bleeding. Protamine sulfate, it is the antidote of heparin, very important. Tranexamic acid, it is used to stop bleeding. So one of the important thing is they can ask you like which are the P2Y12 receptor inhibitors. So antiplatelets like clopidogrel. Most of the time they ask you about clopidogrel is P2Y2 inhibitor, receptor inhibitor. Prasugrel, taclopidine, ticagrelor. So they are basically platelet inhibitor. So what is P2Y2 Y12? This is basically a receptor on platelet. And what do clopidogrel do? Clopidogrel is ADP inhibitor. This is also important point. Adenosine diphosphate. So what will do? The ADP will attach on P2Y12 receptor on platelet and will help in platelet formation, aggregation. So clopidogrel will prevent this formation, this attachment, to stop the further process of aggregation. Very easy. And also important point, this 10A factor. What is 10A factor? 10A factor is very important factor, because without 10A factor no fibrin clot will be formed. So this 10A factor will convert prothrombin into thrombin. It will make the prothrombin active. This thrombin will further activate fibrinogen into fibrin. Now this fibrin will make clots. So there is a direct 10A inhibitor, the drug which inhibit this factor, apixaban. Okay, let's see the drugs. You can use this chart as well, like COX inhibitor aspirin, P2Y12, these one. So they don't ask you about irreversible or reversible, they will ask you directly which one is P2Y12. So you should know about these. And the phosphodiesterase inhibitor dipyridamole, or you can say that dipyridamole is platelet aggregation inhibitor. Okay, so have a look on these drugs, because 2 to 3 MCQs will come from these drugs and these classifications. That's why I'm emphasizing this. You have to learn, you have to make your own notes. So ergotrobin and dabigatran. What are ergotrobin and dabigatran? They are basically anticoagulants. They will ask you about which one is IV and which one is oral. So dabigatran is oral, ergotrobin is IV, and dabigatran, the most important information here, when you are going to use dabigatran, you have to use 5 to 10 days pre-medication. Which pre-medication? Any anticoagulant. Like you can also use clopidogrel for that. Prasugrel, the most important indication for prasugrel that it cannot be used in stroke or ischemic disease because it will lead to more bleeding. Ticagrelor cause dyspnea. How? The main question is how ticagrelor cause dyspnea or shortness of breath. The ticagrelor will increase the formation of adenosine, and this adenosine will cause bronchoconstriction of lungs. That's why ticagrelor will cause dyspnea. Warfarin is mostly used in patients with heart transplant, heart valves transplant, because there is a chance of clotting in that patients. So warfarin is used for mostly for when there is the induction of mechanical valve, because there is 60% chances of clotting around the valve. So a drug, international drug like Coumadin with a brand name Coumadin is used. There is a term INR, International Normalized Ratio. What is this? This is used to check after taking warfarin that whether your blood is more thinner than required or what. Like the normal range is 2 to 3.5. If the value is high, like 10, it means your blood is thinner than required. It should be 2 to 3.5. This is a normal range. So if below 2, it is thick. So when you will take warfarin, warfarin will thin your blood. It will dissolve the clots. So you are taking warfarin for a long time, and your doctor performed this test and the result comes like 7 points, 5 points, 6 points. So he will suddenly stop your drug, because the further taking drug will make you bleeding. So the major bleeding problem is also associated with anticoagulants. Warfarin is also contraindicated in pregnancy. So what is the role of carbamazepine therapy with warfarin and INR? Because carbamazepine is the anti-epileptic drug. Carbamazepine is enzyme inducer, like other enzyme inducers. One of the important thing is you have to know which one is an enzyme inducer, the most important, and which drug is enzyme inhibitor. You have to search the two drugs, phenytoin, rifampin, and cimetidine, and check which one is enzyme inducer, which one is inhibitor. Okay. When the carbamazepine will induce the enzyme which have to metabolize the warfarin. It will metabolize warfarin earlier or with speed. So what will happen? The INR ratio will be, the INR value will be decreased. It will make blood more thick. So these combination is contraindicated. Okay, one of the important concept here is coagulopathy. Coagulopathy is a disorder of blood in which blood's ability to form clot is impaired. So we give vitamin K. So when vitamin K is also given in coagulopathy, and vitamin K can also be given for different reasons. So for coagulopathy, its route will be IV, direct in vein, and when you give to neonates child, it will be IM, intramuscular. So the next is heparin. Heparin is used mostly for dialysis patients, kidney failure patients, because the blood is being drawn from the body into machine and then again to body. So heparin is constantly used in machine to prevent any type of clot. So it is anticoagulant, hemodialysis. It is mucopolysaccharide polymer. But there is a problem. The problem is sometimes there is thrombocytopenia induced by heparin therapy. What is thrombocytopenia? This is the question. So thrombocytopenia is decreased level of platelets in your body. So how it happens? Like the heparin will form a complex with platelet receptors, P4 receptors, and when this complex will be formed, the body will make antibodies against it. So the antibodies will destroy the platelet, and ultimately the number of platelets will be decreased from your body. So heparin causes thrombocytopenia, and for this complex to dissolve this complex, the platelet complex, you will give ergotrobin to cure it, because ergotrobin will not make complex, but it will dissolve the platelet complex. Enoxaparin is also used. If you don't have heparin, you can use enoxaparin for dialysis patient. It is an option, but you have to adjust the dose. Enoxaparin is always given subcutaneously. So like if you have bubble in your injection, bubble in your syringe, and you are giving to patient, there is no problem, because it is given subcutaneous under the skin tissues. And the dose is very important, 1 mg per kg BD twice a day. Like they'll give you a very lengthy question, and they'll give you the weight of patient is, like the weight of patient is 80 kg. So 1 mg per kg means 80 mg. For 80 kg, 80 mg. Twice a day, 80 mg in morning, 80 mg in evening. Twice a day means there are 24 hours in a day. So you will divide in 2 halves, 12 hours, 12 hours, twice a day. Thrice a day, after 8 hours, 3 times a day. Okay. So 80 mg twice a day means 160 mg per day. Enoxaparin mostly used for colorectal surgery, in pulmonary embolism and hemodialysis. Apixaban, I have told you that it is a direct 10A inhibitor. Dipyridamole is platelet aggregation inhibitor. Clopidogrel inhibit ADP, antiplatelet, streptokinase, lyse, fibrin clots. Now osteoporosis, very important. What is the difference between osteoporosis and osteomalacia? One is bone loss, or you can say bone resorption. And here in this osteomalacia, the bones become weak. There is no porosity of bones here. So for osteomalacia, mostly vitamin, it occurs mostly because of the deficiency of vitamin D and calcium. So test for osteoporosis are X-ray. The doctor will do X-ray or DEXA. It is a gold standard test. DEXA, X-ray absorptiometry test. So the drugs used for osteoporosis is alendronate. It is taken weekly once, but alendronate may cause ulcer. So you have to follow these guidelines. How you have to take alendronate? You have to take with a full glass of water to empty stomach. You have to sit like for 30 minutes. You don't have to lay down. Abandronate for monthly. And most menopausal women got osteoporosis. Why? because there is a link of estrogen and osteoporosis. After menopause, the level of estrogen become low, so they get osteoporosis. So a bendronate used monthly. Zoledronic acid is used yearly, once yearly, and this risdronate is specially used for hip fractures. It prevents hip fractures. So for hip fractures, the risdronate is used. And I've told you that the doctor will advise vitamin D and calcium supplement to you, and calcium gluconate will be given along with vitamin D.